Hi, welcome to the Talking Scrubs. This is your medical podcast, and I'm your host, Dr. Ganesh. So, we posted a video earlier explaining the various causes of back pain and how they could present. Today, I'm going to talk to you about how to go about with the pain. So, the traditional advice given for someone with pain is to rest. But the current study shows the other way around. It shows that resting longer than 48 hours would, in fact, actually delay the recovery. So, here's why. In case you're in terrible pain, lying down on the bed for a day to just help you to ease out the pain would seem like a good idea. But ideally, we should modify our activity and try staying in a limited way as possible. It is a more efficient way to control your symptoms. Research shows that if you can find a comfortable position and still keep moving, you may not need bed rest at all. Because staying in a bed for any prolonged period could make the muscles stiff, which could eventually increase the pain. When you don't move or bend, you ultimately lose the strength and flexibility of that particular area, which absolutely hinders your recovery. So the question is, who needs bed rest? Well, the fact is almost no one needs it. The only people who require bed rest are the ones with an unstable spine just after a fracture, or they had a terrible accident, or someone post surgery. You may ask, but doctor, I'm in pain. I can't move. So what do I do? Well, ice packs are the best. They often help, and most of the pain subsides with that. Some get pain relief from painkillers like paracetamol or diclofenac, or even the ones like the pain balms you get in the pharmacies. They help too. But remember, no amount of medication should be taken for any extended period of time. If you feel that the pain is still persistent, or it's been more than 2 days and you still have the pain and you feel like it's worsened, you should definitely seek a healthcare provider immediately. It could be an orthopedician, it could be a physiotherapist, or it could be any doctor who is accessible to you at the nearest. In case you have repeated attacks of back pain, we could say that you have a chronic back pain. You must take it seriously and you should look into the issue. The problem could be arising from the intervertebral discs, we commonly call like the disc related pain, or it could be a simple weakness in the musculature, or you may be having poor core strength. So for such cases you would require active and passive techniques for pain relief. So what are the active approaches we can take? The first one would be walking or simple aerobics, or it could be guided stretches from a qualified physiotherapist, accompanied with exercises specific to strengthen the muscles. Passive techniques may be manipulations in the form of massages or any guided movement or an ultrasound therapy for that matter. Always work with a certified professional. Limit experimenting on random YouTube videos if you're in acute pain. I don't think so. It's a good idea if you're having severe pain and you're just seeing a video and going to try. What if it could harm you or it could worsen the situation? Even if you begin working out later, try to avoid exercises which can directly impact your back, like avoid sit ups or raising your legs immediately without a back support, or any movement which could put strain on your lower back for that matter. Like even if you're lifting a weight from the ground, or it could be a simple suitcase at your home, always maintain a straight back. Learn the difference between being hurt and harming your spine. Say you have sore back after a workout session, that doesn't mean you've harmed your body, but at the same time it doesn't mean you haven't hurt it. It could be anything. Always seek professional help to understand the difference between that. And remember to be conscious about your posture. Be sure you sit or stand tall. On the whole, the sooner you start moving, even with a little amount of progress, the faster you're likely to improve. That's all for today, folks. Thank you for listening. Do spread the word, and we will see you soon with another interesting episode.